What I explain to patients about how Shockwave could work and help them is that there's basically two things that we treat with it. The first thing would be chronic muscle trigger points. So if you've used a massage gun at home or you've gotten massages professionally or from a partner, and it's the same kind of chronic trigger point that you've been working on and it just comes back after a few days, I feel like Shockwave is an appropriate place technology that will help really relieve those chronic muscle trigger points. The other reason that we use it is for tendinopathies. Tendinopathies are where there's a problem with a tendon and it's painful, and we can go in there and we can add the Shockwave, which will penetrate deep into the tissues and then help create what's called microfractures in there. So we're getting that healing response. We're creating a little bit of an injury so that we can get a healing response from the body. The research that's come out recently is showing that the Shockwave is causing microfractures in the tissue. So if you think of it on a cellular level, these are just individual muscle fibers. It's creating little breaks in them. For muscle tissue, it's causing the linkages between the muscle contraction to break. And so it's not breaking them like permanently, like you're breaking a stick of glass or something, or a stick. It's just breaking them down so they can relax. And that's how you get this relief from these chronic muscle trigger points. So if a patient ever asks me, what is Shockwave for? I would say there's two reasons why we use Shockwave. Shockwave is either used to help chronic muscle trigger points, or it's used to help tendinopathies. Yeah, massage is way too painful to work on tendinopathies. So the typical conditions that we use Shockwave for would be like golfer's elbow, tennis elbow, Achilles tendonitis, plantar fasciitis, rotator cuff tears, muscle trigger points. We help break those down. There's linkages that just won't break. And what happens with the Shockwave, it just blocks out the calcium so that these muscles can relax, and the chronic adhesions and trigger points are gone. And usually after one visit, we can see those immediate results if the patient gets off the table and starts moving that body part.